If you're over 60 and taking any prescription medications, what I'm about to share with you could be the most important thing you hear this year. Because 5 of the most commonly prescribed and over-the-counter medications in America are quietly doing something your doctor probably never warned you about. They are damaging your heart, not in some distant theoretical way, right now, while you take them. And the frustrating part is that millions of seniors are taking these medications every single day, trusting that they're safe, trusting that their doctor would have said something if there was a problem. But the research tells a very different story.
Pause. I'm Dr. Anthony Miles, and this channel exists to bring you the latest peer-reviewed research on senior health, explained clearly, without the medical school jargon, so you can make truly informed decisions about your own body. If that sounds like something you want more of, hit subscribe right now so you never miss a video that could protect your health. Now let's get into these 5 medications, because some of them are going to surprise you. We are starting with something that is sitting in almost every medicine cabinet in America. NSAIDs. That stands for non-steroidal anti-inflammatory drugs, and the most common ones are ibuprofen, which you know as Advil or Motrin, and naproxen, sold as Aleve. Seniors reach for these constantly, and why wouldn't they? They work. Arthritis pain, back pain, headaches, ibuprofen handles all of it. But here is what the research now confirms with striking clarity. For adults over 60, regular NSAID use dramatically increases the risk of heart failure. A landmark analysis published in the British Medical Journal examined over 8 million patients and found that people who used NSAIDs had a 19 to 28% higher risk of hospital admission for heart failure compared to those who avoided them. That is not a small number. And the risk jumped even higher in people who were already dealing with high blood pressure, diabetes, or kidney issues, which describes a significant percentage of people watching this video right now. Here is the mechanism, and it matters for you to understand this. NSAIDs cause your kidneys to retain sodium and water. More fluid in your system means more pressure on your blood vessels, which means your heart has to work harder with every single beat. Over time, if your heart muscle is already slightly weakened from age or previous strain, that extra workload pushes it toward failure. The drugs also reduce the production of prostaglandins, which are molecules that protect your heart's blood vessels. Less protection, more vulnerability. Have you been relying on ibuprofen for joint or muscle pain? Comment below and tell me how often you use it. You might be surprised how many people in this community are in the same situation. Now let's talk about the second medication, and this one surprises people every time. Certain antidepressants, specifically a class called tricyclic antidepressants, and to a lesser extent some SSRIs, carry a real and documented risk of cardiac arrhythmia after age 60. Arrhythmia means your heart loses its normal rhythm. It can feel like fluttering, racing, or a sudden thud in your chest. And in severe cases, it can be life-threatening. Tricyclics like amitriptyline and nortriptyline, which are often prescribed for nerve pain and sleep problems in older adults, not just depression, interfere with the electrical conduction system of the heart. A study published in the journal Heart found a 35% increased risk of serious arrhythmia in patients over 65 taking these medications. The SSRIs carry lower risk, but research from JAMA Internal Medicine identified specific drugs in this class, particularly citalopram and escitalopram at higher doses, as being associated with QT interval prolongation. That is a measurement of your heart's electrical timing, and when it stretches too long, dangerous arrhythmias can follow. This does not mean you should stop your antidepressant today. Absolutely do not do that. What it means is that if you are over 60 and on one of these medications, you should be getting periodic EKGs to monitor your heart's electrical activity. Many seniors on these drugs have never had that conversation with their prescribing doctor. Let me tell you about Margaret, a 68-year-old retired teacher from Ohio. She had been on amitriptyline for 3 years for nerve pain in her legs. She started experiencing occasional heart palpitations, that fluttering sensation. She mentioned it to her doctor at an annual visit, almost as an afterthought. Her doctor ordered an EKG and found significant QT prolongation. They switched her to a different medication for her nerve pain, a non-cardiac option, and within 6 weeks, her palpitations resolved completely. Margaret told me she wishes someone had monitored her heart from the beginning. The lesson here is that what feels like a minor symptom can be your heart asking for attention. The third medication is one that almost no one associates with heart risk, and that is exactly why it is so dangerous. Proton pump inhibitors, or PPIs, are drugs like omeprazole, sold as Prilosec, and esomeprazole, sold as Nexium. Tens of millions of Americans take these for acid reflux and GERD. They are sold over the counter, so people assume they are essentially harmless. But here is what the research has revealed. Long-term PPI use depletes magnesium, and magnesium depletion is devastating for your heart. Magnesium is not optional for cardiac function. It regulates the electrical signals that keep your heart beating in a steady rhythm. It controls how calcium flows in and out of heart muscle cells. Without enough magnesium, your heart becomes electrically unstable. A study published in Circulation, one of the most respected cardiology journals in the world, linked chronically low magnesium levels to a significantly higher rate of atrial fibrillation, which is the most common cardiac arrhythmia and a major driver of stroke risk in older adults. The problem is that PPI-induced magnesium depletion happens slowly, over months and years, and the early symptoms are easy to dismiss. Muscle cramps, fatigue, mild sleep disturbances, nothing that screams heart problem. But underneath, your cardiac tissue is becoming more and more unstable. If you have been on a PPI for more than a year, ask your doctor to check your serum magnesium level at your next visit. It is a simple blood test. And if your levels are low, discuss whether continuing the PPI makes sense or whether you need magnesium supplementation alongside it. The fourth medication is something millions of seniors use every single night: common sleep aids. This includes over-the-counter options like Benadryl, which contains diphenhydramine, as well as prescription medications like Zolpidem, sold as Ambien. The cardiac concern here is blood pressure dysregulation, and it operates through a mechanism that most people find alarming once they understand it. Diphenhydramine, the antihistamine in most OTC sleep aids, has anticholinergic effects, meaning it blocks certain signals in your nervous system. In younger people, this is manageable. In adults over 60, whose nervous system regulation is already less efficient, it can cause significant swings in blood pressure, both dangerously high spikes and sudden drops that increase fall risk. A 2022 study in JAMA Network Open found that older adults using anticholinergic medications had measurably higher rates of cardiovascular events, including heart attack and stroke. Prescription sleep aids like Zolpidem carry a different mechanism but an overlapping concern. They suppress nighttime blood pressure fluctuations in ways that can disrupt your heart's natural recovery cycle during sleep. Your cardiovascular system uses nighttime to reset. Interfering with that process has cumulative consequences. This is the part where I need you to pay close attention, because what comes next connects everything together. There is a safer path forward for sleep issues that does not compromise your heart. We will get there. But first, let us cover the fifth medication: decongestants. Sudafed, Dayquil, NyQuil, and dozens of other cold and flu products contain pseudoephedrine or phenylephrine. These compounds work by constricting blood vessels throughout your body to reduce nasal swelling. But they do not just constrict the blood vessels in your nose. They constrict blood vessels everywhere, including the ones surrounding your heart. And for anyone over 60, particularly those with existing high blood pressure or any coronary artery disease, this can trigger what cardiologists call a hypertensive crisis, a sudden dangerous spike in blood pressure that can lead to stroke, heart attack, or heart failure. The American Heart Association has issued explicit warnings about decongestants for people with hypertension, and yet these medications are sold freely, sitting right next to vitamins at the pharmacy, with packaging that does not prominently warn older adults about cardiac risk. A single dose of pseudoephedrine can raise systolic blood pressure by 20 to 25 points. For someone whose baseline is already borderline, that can push them into emergency territory. Frank was 71, a retired electrician with well-controlled high blood pressure. He caught a bad cold last winter and grabbed a Dayquil from the pharmacy. His wife found him disoriented and flushed 2 hours later. His blood pressure in the emergency room was 198 over 112. He had been taking a perfectly common, widely sold cold medication without any idea it was contraindicated for someone on blood pressure medication. He recovered, but he spent 2 nights in the hospital. So here is exactly what you should do with all of this information. First, review your current medication list this week. Write down every drug you take, including over-the-counter medications, and bring that complete list to your next doctor's appointment. Ask specifically whether any of these 5 categories appear on your list. Second, if you take NSAIDs regularly for pain, have a direct conversation with your doctor about alternatives. Acetaminophen is safer for your heart for most uses. Topical diclofenac gel is another option that delivers anti-inflammatory effects locally without the systemic cardiovascular burden. Third, if you are on a PPI for longer than 1 year, ask for a serum magnesium blood test. If levels are low, ask about magnesium glycinate supplementation, typically 200 to 400 milligrams daily, which is the most bioavailable and gentlest form on the digestive system. Fourth, if you rely on over-the-counter sleep aids containing diphenhydramine, talk to your doctor about melatonin at low doses, between 0.5 and 1 milligram, taken about 90 minutes before bed. This is evidence-supported and has no cardiac risk profile in adults over 60. Fifth, and this is critical, read every cold and flu medication label before you take it. If you see pseudoephedrine or phenylephrine in the ingredients and you have high blood pressure, put it back. Ask your pharmacist for a cardiac-safe alternative. Nasal saline spray, steam inhalation, and guaifenesin-only expectorants will not spike your blood pressure. As always, do not stop any prescription medication without talking to your prescribing physician first. These conversations are essential, not optional. Your doctor may have very good reasons for your current regimen, but you now have the knowledge to ask the right questions, and asking the right questions is how you protect yourself. 5 common medications. 5 genuine documented cardiac risks that disproportionately affect adults over 60. The goal of this video was never to scare you. It was to give you exactly the kind of specific, research-backed information you deserve to have. Comment below and tell me which of these 5 medications you are currently taking, or which one surprised you the most. I read every comment, and knowing what resonates with this community helps me know what to cover next. If this information opened your eyes, comment the word sharing because someone you love may need to hear this today. If you found this valuable, please subscribe to this channel. Every week we translate the latest cardiology and senior health research into practical steps you can actually use. Next week we are going deep on something that cardiologists are calling a silent epidemic in adults over 65, a common deficiency that is almost never tested for, but that doubles your risk of heart attack. You will not want to miss that one. I'm Dr. Anthony Miles. Take care of your heart because everything else depends on it.